Hello everyone and welcome to our video briefing of the Health Partnership Capacity Development Programme. My name is Alice and I'm the training coordinator for this programme as part of the Learning and Policy team at FET. We will begin by introducing what the programme is, the objectives and scope. We'll then discuss eligibility criteria and highlighting some of the things that we're looking for in the applications before looking at the next steps and timeline for the programme. The Health Partnership Capacity Development Programme will work with civil society organisations, or as we will call them here for short, CSOs, across the UK who are working in partnership with health institutions and those delivering health-related projects in UK aid direct eligible countries. It is known how much good work happens from small organisations and health partnerships for the strengthening of health systems in low and middle income countries. This is recognised within the global health community, across the literature and in policy. However, it is also known that small organisations struggle to meet the rigorous eligibility criteria for grants available to support their work. This programme is designed to fill that gap, both enabling small CSOs to be more resilient by being more successful at applying for funding, which will ultimately mean they become stronger and forming more resilient health partnerships in the process. This will thereby support increased sustainability and scale up of reach and impact, benefiting the CSOs, their overseas partners and beneficiaries. Ultimately, the programme will contribute to further health system strengthening of LMICs. For clarification, we'll just define what a CSO is and what we define as a health partnership. So CSO, civil society organisations, may include charities, development NGOs, community groups, women's organisations, faith-based organisations, professional associations, trade unions, social movements, coalitions and advocacy groups. CSO may be affiliated to a health delivery institution, health training or education institution, regulatory body, NHS arm's length body, professional membership association, academic institution or diaspora-led organisation. This partnership capacity development programme is specifically looking to work with small civil society organisations. So there is a maximum amount that we are expecting you to sort of have as an annual report and an income. This specific programme is about working with health partnerships. Health partnerships are long-term institutional relationships between the UK and LMIC health institutions. Health partnerships aim to improve health services and systems in LMICs through the reciprocal exchange of knowledge, skills, experience between partners. Health partnerships have been shown to be a model for capacity development that offers an effective, sustainable and value for money approach to strengthening national health capacity, while also resulting in the strengthening of the UK healthcare workforce. Health partnerships often focus their activities on projects that support human resources for health development and the strengthening of health systems through activities such as clinical pathway and policy development, and again, the capacity development of education of health workers. So the main objectives of this programme is to build the capacity and resilience of small civil society organisations working through a health partnership model with a partner in low and middle income countries. Part of the eligibility funding is to be able to demonstrate certain attributes of your health partnership when it comes to applying for the bigger bids. And these can often seem overwhelming to a small health partnership run by health professionals who volunteer their time and incredible health expertise, but without the background in international development sector or applying for funding. And this programme is designed to help you within these following categories and more. So the first will be strategic planning. It's about ensuring that you have a shared vision with your partners, long-term aims and measurable plans for achieving them. It's important that the partnership's work is consistent with local and national plans and complements the activities of other development agencies in the area. And we'll help and have a discussion about how we might map these. The second is governance and financial competency. So funders are looking for partnerships with strong governance arrangements, financial systems and controls, and we'll work with you to advise what is necessary, ensuring the health partnership is organised and accountable and meets the budgetary requirements. Third is duty of care and safeguarding. The requirement for risk registers and for CSOs to address safeguarding relevant to their work has rightly risen in priority in recent years. We will support CSOs to develop the required documentation, which is inherently linked to ensuring and articulating how CSOs conduct their activities with integrity across all interactions with stakeholders and beneficiaries. The fourth is digital transformation. And all organisations have had to think how to adapt their work in an age of climate crisis and in a time when the pandemic has been forcing changes to the way we all work. Through peer interaction, we will consider how we embrace the digital transformation within health partnerships, and indeed including the delivery of this programme. Number 5 is project management and design. This programme will assist CSOs to think through the project lifecycle from partnership development, needs assessment and gap analysis to action planning, action, evaluation and review. This will support health partnerships to operate in a way that delivers high quality projects that meet targets and achieve long-term aims. Number 6 is monitoring, evaluation and learning. Health partnerships is all about joint learning. We will support CSOs to develop their skills in the key components of all monitoring, evaluation and learning, and to consider how to nurture a culture of reflection and learning. We will also consider how to articulate the lessons learned and how best to share this learning with others. And number 7, gender equality and social inclusion. Gender equality and social inclusion, known as GESI, has recently been added as the THET's 9th principle of partnership. It's essential for CSOs to consider unequal power relations and inequalities experienced by individuals as a result of their social identities. We will guide CSOs on how to conduct GESI activities and analysis to ensure GESI is mainstreamed into their planning and activities. This list is not exhaustive, but covers some of the key areas that will be covered. So the programme will be through a holistic approach that will guide successful applicants through a process to assess their capacity development needs, which will be underpinned by THET's principles of partnership. There will be an initial introductory phase, which will involve self-assessing your partnership against our principles of partnership. And we will guide you through this process and your understanding of the principles. This will inform a bespoke development action plan for your partnership for how to engage with the training programme that aims to guide CSOs through the previously mentioned areas. Training workshops, small group discussions, an online community platform and a membership scheme will improve participants' capacity to deliver quality health partnership projects. Each CSO will be assigned a mentor who will support their development action plans and accompany them at intervals throughout the project to support them in achieving their goals. CSOs will be supported to establish active networks for learning and peer-to-peer support throughout the lifetime of the programme. No doubt, CSOs will also have lessons for us. Learning through the programme is expected to be multi-directional with ongoing developments during the 2 years based on participants' interaction, feedback and progress. So the eligibility. The core requirements is really that applications are made by small CSOs who manage a health partnership between a UK health organisation and a low and middle income country health organisation, which is based on one or more of the countries identified in the call. Partnerships will be expected to demonstrate how each of the partners will actively engage in the programme, although we are in acknowledgement of the difficulties at the moment due to the COVID pandemic. The partnerships must involve an eligible country, and to see if your partnership is eligible to participate, please check the UK Aid Eligible LMICs link available on the UK Aid website. Applications must be made in English, and unfortunately, we cannot accept applications written in other languages. And the majority of the health partnership project activities must be carried out by volunteers. So the UK CSOs must be registered with the relevant UK Charity Commission, or in fact with Companies House that work with a health partnership approach within an LMIC. The UK CSO must be registered but have an annual income of under 400,000, very much on the principle that we're looking to support small CSOs to enlarge their work. CSOs not affiliated with health institutions, including diaspora-led organisations, are also eligible to apply. And we're also interested in hearing from health partnerships that could be mentors for other health partnerships. So if you're interested in getting involved, but feel your partnership may be too successful or too large, still please do apply or get in touch with us directly by email. We're aware that there's a widening diversity of the type of organisations that work in a health partnership sense, and you may not be a registered charity. If you have any queries about how your institution works or your partnership works, please do come and get in touch with us, because we're also learning about different approaches that we might be able to support. We anticipate that this programme will involve roughly 12 hours per quarter of engagement from your partnership in the training. As we're conscious of capacity restraints due to COVID, there's space in the application form to outline any capacity challenges within your partnership that may affect your ability to engage in training in the current context. And the programme will run from April 2021 through to December 2022. So what we're looking for is actually you outlining your sort of challenges and weaknesses within your capacity to deliver projects, including challenges in the project and financial management and maybe monitoring and evaluation. It's really about us finding out how we can help you. The partnership outlines how both partners will be actively engaged in the programme's process. We're keen that we also have involvement of our partners overseas. And the CSOs should be able to provide your latest annual return as logged with the appropriate organisation, highlighting where possible your annual income. So on the slide here, you can see that the timeline for applications and start of the programme, and the call for applications will close on the 31st of March at 5 p.m. UK time. For the applications, an initial review and shortlisting of all applications will be undertaken against the criteria, and we may contact you to seek further clarification before making final decisions. We will let you know by the 14th of April, and the training package will begin in early May. All the documents are able to be found on the website, and if you have any queries at all, please contact us by emailing training@thet.org. Thank you very much for your time.